Well, hello. This is Greg Downing. Now, my official name is John Gregory Downing, and if you're in the insurance business, you have to use your official name. So if you see stuff from John Downing, you know that's me. I'm one and the same. I am with Texas Medicare Advisors here on the outskirts of Austin, Texas, and I specialize in helping individuals sign up for Medicare and get the right Medicare supplement plans at the right price. I would like to introduce you to my cohort in crime, and that is Rochelle Abbott. Rochelle Abbott is a licensed insurance agent. She gives fantastic customer service, very detailed oriented, which helps me out because I'm not the best at that. And we work as a team to help you get signed up for Medicare and taking care of everything, because there's just sometimes when I'm unavailable or vice versa, and we want to have you have at least two folks to help you. Now, you may be saying, oh my gosh, this could cost me a whole lot of money to use your service. Well, here's the fantastic news, is it doesn't cost anything to use our service because we are paid by the insurance companies to help you find the plans that meet your needs and your budget. So no matter where you go, who you use, all the prices are the same. There are no special internet deals when it comes to Medicare. Now, if you're like most of my clients, they hear of a lot of things that they just find hard to believe. Stuff on TV like, oh my gosh, you can get free groceries. Really? And everybody loves the $1,000 flex cards that you can spend on whatever you want. And then you'll also hear, oh, you can get free rides to the doctor. Well, some of that is sort of true, but not really. They'll take you to the doctor, but no one will pick you up. So there's a lot of misinformation out there just to give you or get you to give them a call so they can try to sell you a plan. But I'm going to share with you exactly what I would do if I were signing up for Medicare today based on helping thousands of people do this. All right. So there are two parts of Medicare that you have to have no matter what you do. Medicare Part A, and you have to have Medicare Part B. So what I'm going to do is dive into each of these so you understand what they cover and, more importantly, what they do not cover. So let's take a look at Medicare Part A. That's your hospital coverage or your hospital care. Now, the way it works is your Medicare Part A cost is normally free as long as you have earned your 40 credits, which basically is working about 10 years to get that. Now, if you don't qualify for that, you can also claim through your spouse for their work. Say if you were a homemaker that whole same time, that's another way to get your Medicare Part A at no cost. Now, your Medicare Part A has a $1,676 deductible in 2025. So if you're admitted to the hospital, that is your responsibility to pay that. There's also additional costs. Crazy enough, you have to pay for your first 3 pints of blood. I have no idea why they came up with that, but I guess it's expensive and they don't want you to have too much of that unless you pay for it. And if you are in the hospital for an extended period of time, a long time, you have copays, and they can get up to $838 per day. And if you're in the hospital for more than 180 days, God forbid, there is no coverage. None. So the Part A is awesome, but you still have a lot of exposure or potential costs that you would have to pay if you just had Medicare Part A. All right, so that's Medicare Part A. Medicare Part B, that covers your doctor visits, preventive care, ambulance services. If you get diagnosed with cancer, you need chemotherapy, that's covered under there, as well as medical equipment and things like that. So if you're not already on Social Security, you're going to have to reach out and sign up for your Part B. If you're on Social Security, they automatically sign you up. But if you're not, you're going to have to sign up online, and it takes them at least a month to process that application. That's the only way you can do it now. So you just want to get in there as soon as you can. Now, your Medicare is always going to start the month that you turn 65. So if your birthday is on the 17th, it's going to start the beginning of the month. Doesn't matter. Now, you can sign up later, but best practices, just sign up as soon as you can to get on your Medicare Part B. Now, Medicare Part B is not free. Most people are going to pay $185 a month in 2025. Now, if you are a high income earner, it's going to cost you more because the way the government works is the more you make, the more they take. All right. So if that's a discussion we need to have, you need to let us know. Otherwise, you're going to be paying more than $185 for your Part B. Now, Part B has a $257 deductible in 2025. They're not going to pay anything until you hit that deductible. Okay, then after that, Medicare pays 80% and you pay 20%. Now, the problem is there is no cap on that. So let's say you got chemotherapy, the treatment costs $100,000. Yikes, you got to pay $20,000. So while that's great, there are additional costs that you will have and could run thousands and thousands of dollars. So most of my clients are not comfortable with this. So what do? We sign up for a Medigap plan or a Medicare supplement plan. They are exactly the same thing. For some reason, the government likes to have two names for the same thing. So a Medigap plan and a Medicare supplement plan are the same thing. They just have two different names. Now, what does that Medigap plan pay for? Well, it's going to pay for your Part A deductible. So you don't have to worry about that. Any co-pays under Part A, you don't have to pay for that. The supplement plan is going to do that. Now, and it also pays the 20% co-insurance under Part B. So the only thing that a Medigap plan is not going to cover is that $257 Part B deductible in 2025. Now, we have two plans that we sell. Plan G, which is the most comprehensive plan, and Plan N, which is, many people will say, more cost-effective plan, but either one of those plans do basically the same thing with a little nuances. All right, so that's what happens. Now, you get that. Let me go back here a minute. So when you get your Medicare Part A and B and your Medigap plan, you can see any doctor, hospital in the country as long as they take Medicare. You do not need a referral. And by law, whatever Medigap plan you have, if it's Humana, United Healthcare, Greg's Dirt Cheap Insurance, they have to take it. So it's good anywhere in the country. All they have to do is take Medicare and they will see you and no referral is needed. All right, so that is my recommendation for the best possible coverage. Now, you're going to need to get a Part D or a Medicare prescription drug plan. Now, these plans, they currently here in Texas, there's 15 different plans to choose from. So you go, well, hey, what plan do I need to sign up for? Or how do I know what's best for me? Well, what we're going to need to do is get a list of your prescriptions and what pharmacy you like to go to, and then we'll help you find a cost-effective plan for you. Because just because your brother Larry uses X and YZ company, it's great. It may be horrible for you. So these are very individual-driven plans, and we need to get that information so you do not overpay for your prescription drug plan because they can get very costly. And for many people, their biggest cost is in prescription drugs, not their Medigap supplement plan. All right. Now, some of you go, well, I don't even take any prescriptions, medications. I don't need that. I'm not going to get one. Well, that is an option, but you will have to pay a penalty for the rest of your life when you do sign up for one. So we just recommend getting one regardless because you just never know what's going to happen. All right, so there you go. You got that, and then your prescription drugs. But Medicare doesn't cover everything, all right? So one of the things that we recommend is looking at additional coverages like dental. This old boy here could definitely probably use a little help on his dental insurance. So if you need that, those are extra coverages that you can pay for. Same thing with vision, hearing. Now, cancer. Yes, Medicare covers cancer. The supplements cover cancer. What we recommend, because what I've seen is there's a lot of additional cost associated with cancer that's just not your medical treatment. There's travel. I've got a guy now that's having to travel. He gets treatment 4 days a week, and he has to travel an hour each way, and his wife has to drive him because when he's getting his chemotherapy, he can't drive back. So those are additional costs. Also, some of these prescription drugs are $7,000-8,000 a month for oral cancer medication. So it's just something to think about. I have $20,000 on me and my spouse. Why? My dad had cancer, my mom had cancer, my brother has cancer. On my wife's side, her mom, dad, brother have died from cancer, and both of her sisters have had breast cancer. Hello. So that's just an additional thing that doesn't cost a whole lot of money. It's additional help on the cancer side, totally up to you. But I do see that is a problem, and that's something to think about. All right, so additional coverage, we can help you with all those things. And let's talk about one other thing no one really wants to talk about, and that's long-term care. All right. Why? Well, Medicare does not pay for long-term care. And 70% of us are going to need some type of long-term care once we hit 65. For example, that good-looking man right there, that's Johnny Lee Downing. That's my dad. He and mom, we had to put them in assisted living at Red Raider Ranch up at Texas Tech or in Lubbock because they couldn't take care of themselves anymore, and 911 kept going out there to help them get up because one would fall down and the other one couldn't get up. It's a horrible situation, but they were in assisted living for 3.5 years. Mom passed away. Dad moved in with me and my wife, and we took care of him for almost 4 years. And I'm telling you what, there was a lot of money spent on taking care of him. And if you don't have some type of long-term care plan to help you manage costs, you can blow through all your retirement money. So that's something I recommend you just schedule a little bit of time to visit with us and our key people to find out more ways to look at how to make sure you don't blow through all your money if you need long-term care. All right, so 6 things you need to do now. That's a strange-looking fella, but they are 6. Number 1, you got to get your Medicare Part A. Number 2, you got to get your Medicare Part B. Number 3, you got to get a Medigap plan, N or G, totally up to you. 4, we got to get a prescription drug plan. And you need to think about additional coverages if you need those, and start thinking about a long-term care plan. All right, now, just 1 through 4, 1, 2, 3, 4, all this costs money. All right, so I'm telling people if you need going this route, you need to budget about $350. Now, it could be less, be a little bit more depending on certain things, but you need to budget that amount. Now, I've got people that says, oh, man, I'm on a very tight budget. I don't even know if I can pay the $185. Okay, I get that. So if that is a situation you're in, then we probably need to just visit about a Medicare Advantage plan or Medicare Part C. Again, here's something, same thing, 2 names. The Medicare Advantage plan is the same as Medicare Part C. And that's where the government contracts with all the insurance companies and says, hey, we're going to pay you money. You go set up a plan, and everybody you enroll into your Advantage plan will pay you X amount of dollars per month. Now, what people like about these is some of their plans have a 0 premium. You still have to have your Medicare Part A and B, so you still got to pay that. But you can get these plans, and they include a prescription drug plan, some dental, vision, other benefits, which are great, but this is a managed care plan, so you're talking HMOs, PPOs, and you have to abide by their rules. So if we need to talk about that, we certainly can. That is another option. We help people with that all the time as well. So what now? Well, if you can complete the scope of appointment form form that's attached to the email or wherever you can get that. That's just giving us permission to talk to you about these plans, and that's something we have to keep on file for 10 years. Why, it's just crazy, but that information is needed. Also, if you can give us your home address, zip code, things like that, and then we'll need your medications and what pharmacy you want to use. Also, your doctors, especially if you're thinking about doing an Advantage plan. We're going to need a list of your doctors and your hospital and make sure that they're in network. Now, once we get that information, then we can provide you a cost analysis, different options on your best way to move to Medicare. We get that together. And then we get that. We're going to review the proposal with you. We'll go over all that, make sure all your questions are answered, and we get the plans that you want, not somebody else wants, at the most affordable pricing. So that's it. Have a blessed day. Complete that application, get it to us, and then we'll get back with you and get you all set up for Medicare easy peasy.